Let's look at contraceptive injections, like Depot. Injectables are needed regularly, every 2 to 3 months, to prevent pregnancy. These are injected by a health provider or yourself, depending on the type. Injectables stop the release of an egg each month, thin the lining of the womb, and thicken its barrier, making it harder for the man's sperm to get through. Once the injection is in, it can't be removed, but will slowly leave your body naturally over time. This means that it may delay your ability to get pregnant when you stop using it. It can take up to 10 months for your normal fertility to return, but can be more if you've been using injectables for a long time. Injectables are great for women who can do something every few months for protection, and for women who don't know when they want to get pregnant or don't need to get pregnant quickly when they stop using contraception. It's also safe to use when breastfeeding if your baby is 6 weeks or older, which is great news. No one can tell you've had the injection, so only you'll know you're using contraception. However, injectables do have side effects that may be noticed. All women will experience at least some changes to their monthly bleeding, like irregular or longer periods in the first few months. After that, bleeding may be infrequent, irregular, or even stop. Many women gain weight when using injectables. It's only usually a small amount, but it can be more, normally between 2 and 5 kilograms. Some women may also experience headaches, dizziness, bloating, and mood changes. Injectables don't protect against HIV or other sexually transmitted diseases. So if you're worried about this, use condoms at the same time for extra protection. You may have heard some myths or rumours about injectables, so here are the facts. If your monthly bleeding changes or stops with injectables, it's not dangerous and won't affect your future ability to have children. With less lining building up in your womb each month, there's less to release. Injectables can affect some women's desire to have sex, but not having to worry about pregnancy can make sex more enjoyable. If you or your partner are interested in finding out more, speak to your friendly Marie Stopes provider for confidential information and advice that you can trust.